Let's pay attention.
Tell me about how this thing started.
This eye issue started when 2023. Initially, it was opening a little. It will open and it will close, like come and go, come and go. After some time, I went to the hospital. They gave me a eye glasses, a lens. So as I was using it, after a time, like I noticed that it's affecting the eye the more. The eye is falling down. So I don't have to stop it. I went back to the hospital and I told them that it's affecting the eye. They should give me a new one. They have to change the glasses again for me. So when they change the glass, I keep using it. I notice that the eye keep dropping the more. So I have to stop using their glasses. And I decided to go to another clinic again. So directly to this teaching hospital.
So I saw this patient about 2 days ago. When she presented to me, it didn't take me up to 5 seconds. And I asked her one single question that I knew exactly what the problem was. And I was so confused as to why these eye clinics were giving her glasses. So that was my patient's ordeal. This patient has something called Myasthenia gravis. What is Myasthenia gravis? Stay tuned. Only on I Matter with Dr. S. Myasthenia gravis is an autoimmune condition. Let's break that first. When we say autoimmune, it means our body is attacking us. So normally everybody has fighters in their bodies that fight infections like respiratory infections, malaria, just any type of thing that is trying to harm us. But in people with autoimmune diseases, those fighters are fighting us instead of concentrating on external enemies that are trying to attack our bodies. And what that means is that you are not safe from your own fighters. In myasthenia gravis specifically, our fighters are fighting something called the acetylcholine receptor. These receptors are like baskets. Now, these receptors are supposed to receive something called acetylcholine. It is only when acetylcholine enters this receptor that we'll be able to move our muscle. For example, if you want to open your eyes like this, or you want to close your eyes like this, or you want to move your hand or legs, just like how these balls are entering the basket. But when our fighters attack the baskets, that means there will be no baskets to receive all the balls, and the balls will just be floating in space. These patients are usually very energetic in the morning because in the mornings when they just wake up, the amount of balls that they need during sleep is something that can fit into the remaining basket. You don't need a lot of muscular movements during sleep. But by the time you wake up and you start needing to do things, then you need more balls inside this basket. But unfortunately, there are no baskets to accommodate the balls. So they get tired during activity and then they feel better during rest. Myasthenia gravis can occur in women and can occur in men, although it is more common in women and it's common in young women starting from 20 years of age. In men, myasthenia gravis occur around 50 years of age. These patients, as you can see, my patient, her eyes are drooping. We call them droopy eyelids. She is having so much difficulty being able to keep her eyes open and to sustain them open because her muscles are tired. She also has difficulty doing anything that requires her to raise her hand. And anytime she's speaking, by the time she speaks for like 2 minutes, her speech begins to get slurry. She just loses control of what she's saying because her tongue also has muscles. These patients can also have double vision, even movement of their eyes like left, right, up, down. All of this require muscles. So a lot of them be seeing things in two. Sometimes it is only the eyes that the disease will affect. This is called ocular myasthenia gravis. And sometimes it will affect other parts of their body. In this particular patient, it is affecting her all over her body. And in some really bad scenarios, it can affect the way they breathe because breathing also requires muscles. They get tired of breathing and they can actually die from not being able to breathe properly. And a lot of these patients can also have other types of autoimmune diseases like arthritis, rheumatoid arthritis, lupus, like what Selena Gomez has. Now that we've understood myasthenia gravis, it's obvious that wearing glasses is not the way to go. These patients are managed by an ophthalmologist, and specifically a neuro-ophthalmologist. These patients cannot be managed by optometrists. My patients mentioned that one of the hospital she finally went to referred her to the teaching hospitals. Now, those are people that actually know what they're doing. When we see these patients, we ask them all these questions. We look at their old photos. We can compare the way their eyes looked then till now. We do some tests, including here. I asked her to sleep for 30 minutes, and by the time she opened her eyes were wide open, which is reflective of what I just explained. We send them to do some blood tests that can also help us confirm the diagnosis. These patients can be placed on steroids. They can also be placed on a drug that help to make those balls more available, because apart from the balls entering the basket, there's another thing that helps to get rid of the excess balls so that the basket has exactly the amount of balls it needs. But because the baskets are being destroyed, we have to compensate by allowing more balls to be available. And that's how the drug for this disease works. So this video is extremely important because I expect that people who follow me and follow my page understand these differences between eye care professionals and are always open to seeking second and third opinions, especially from ophthalmologists. Because why? Now, we talk about time is valuable. Thank you for watching, and I'll be seeing you in my next episode.